Today, I'm welcoming Dr. Ilan Ben-Zion back to the Health Perspective. Ilan is a clinical psychologist who works with people with a wide range of difficulties, including anxiety, trauma, and long-standing relational problems. In this episode, we're discussing one of the commonest issues we see, people-pleasing. What is it? Why is it so common? And how it links to anxiety, identity, and burnout. If you struggle to say no or constantly put others first, you'll want to listen to this. Ilan, welcome back.
Thank you. Pleased to be here.
Let me start by asking you the trickiest question. Are you a people pleaser?
Am I a people pleaser? I think if I'm very honest, I probably used to be more than I am now. When I was younger, quite shy, quite quiet, quite wanting to be liked, etc., and therefore more likely to be a people pleaser. Whereas now, especially working as a psychologist, you see the downsides of that, which means I've much moved over to still being hopefully a nice person, but maybe thinking about myself a bit too.
Okay, good. I'm glad you've been on that journey.
Yeah, I have indeed. And there you go.
This is a difficult area because we've got to tread this line between, I guess, genuinely wanting to help people, which is a good thing, and doing too much or people pleasing. How do we kind of think about that line and tread that line? What's the difference between giving enough of yourself and giving too much of yourself?
So I suppose there's going to be some natural variation, right? There is going to be some natural. Some people will be the more people pleasing, not people pleasing, maybe selfless, if that's how you want to characterize it. Some people are much more about they get pleasure from supporting others or looking after others or making others happy. But that aside, I suppose we need to make sure that a person, any individual listening to this or watching this, is not completely sacrificing themselves for someone else's needs. For example, if I do everything for you to make you happy, I'll be pleased that you're happy, but therefore I might have sacrificed my own happiness, which will make me sad. And then if I'm sad, that make you sad. So actually, arguably, by trying too much to make you happy or to meet your needs, I could then actually have the opposite effect, because I'd be sad, which would then in turn make you that as well.
Okay, so it's almost cyclical in that way.
It has the potential to be if there's not a break in that cycle somewhere, if it's not just one-way traffic all the time.
Okay, in my experience as a GP, I see this as a broader topic, kind of conscientiousness and people pleasing, as quite a significant underlying factor in mental health difficulties. How often do you see this come up as a theme in therapy? Is this common?
Incredibly common. It comes up, I don't know how often, but often in, if you look at anxiety, people might be socially anxious because they want people to like them, or they want to make them happy, or they want to feel like they're positively contributing to conversation. And yes, everyone wants that to some extent, but they may not be defined by it, or they may not worry about it to the extent that a people pleaser might worry about it. So it's coming up in different ways, in different circumstances. Depression, for example, someone might be sad because they don't feel like people like them enough, and therefore what they do is they try even harder to make people like them, which actually has the potential to push people away, which what that does is it then validates their belief that no one likes me, so they try harder, which makes people, well, that's a bit intense, that's a bit much, pushes them away. And what it does is it just reinforces that belief, which reinforces the people pleasing, which reinforces the low mood.
So there's a lot of reinforcement. When we're talking about this, we're talking about a lot of reinforcement.
100%, all the time. It's constant feedback, isn't it?
And the difficulty is that doing things for other people, being conscientious, doing charity work, working in a community, we know those things are protective. Well, they're good things to do from a moral perspective, an ethical perspective, but to a degree they are protective for our mental health. But there is a line that's drawn where they become more difficult. Is there an easy way to find that line? Is there an easy way to define that line?
It's a tricky one. As you say, all of that sort of work is fantastic, but if you were exclusively doing that work all the time, every day, then there's something missing. There's likely to be something missing. Now, what is that thing that's missing? What I often will do with my clients is I'll think about what's important to you. I'll talk about topics like values, right? You might look at what's their values, what's important to them at home, in their relationships, in their personal growth, in their work, in their education, whatever it might be. And we'll look at what's important to you and how much are you doing those things. And what you often will see is there's a disconnect between, this is really important to me, my kids are really important. When was the last time you spent time with them? 2 months ago. And well, why? Because I've been doing this all day for this person. And what you're trying to get is you're trying to find a balance between the charity work that they maybe want to do, or the community work, or whatever it might be, plus making sure that they're also looking after themselves, because if you look after yourself, you look after everyone else as well.
Yeah, the analogy I always give my patients when I'm having a similar discussion is, if you're on a plane and the plane is going down, you put your own oxygen mask on
Absolutely.
first, because if you put your kid's oxygen mask on first, or your partner's oxygen mask on first, or even someone you don't know's oxygen mask on first, you're both going to die or whatever, or suffer. But you have to put your own oxygen mask on first, and that's not selfish. If a plane is going down, that's just kind of survival, and then you have the chance to help as many people as possible.
Yeah, I see this all the time. Is people are so keen to help or desperate to look after others, but by sacrificing themselves, it doesn't work.
Yeah.
It doesn't work. And you really, this is, again, as you say, like, it's not about being selfish, so to speak, or only looking after yourself. It's finding a balance which looks after you and looks after them as a result of it, so that you get both people in the best place they can possibly be.
The other thing that I see specifically, and the thing I talk to my patients about, is the burnout spiral. And the problem with people who are conscientious is that they will give up from themselves first the things that are protecting their health. So if you've got a busy parent, for example, they've got responsibilities at work, and they've got responsibilities at home, and they've got responsibilities for a charity they might work for as well. And their schedule is effectively, like most of us nowadays, is completely packed out. But they also get in 30 minutes a day for the gym, or 20 minutes for meditation, or for hobbies, or something like that. What happens is, if one of the main areas of their life, their responsibilities, increase, so at work, someone says to them, I need this project done, you've got to pull the extra hours. What a conscientious person might do is immediately chop out one thing, like going to the gym, that actually protects their health. And so they get stuck in that cycle, and then they're not going to the gym, so they feel burnt out and a bit resentful. And then the problem is, because they're tired and more resentful, they're kind of less productive, and they start to fall apart in other areas of their life. And things at home may not be going so well. So what they then do is they chop out something else, like a hobby or the charity work. And because they're conscientious, they always sacrifice the things that are protective for them. And gradually they remove all the things that are protective for them, and they end up spiraling down into this place where there's nothing left but responsibilities, nothing left but the core things they need to get done every day.
Yeah, which end up not being done well, which actually negates the whole thing in the first place, right?
And there's a strong link between that and anxiety and depression, because the gap between that, when you've chopped out everything protective in your life and ending up anxious and depressed, the gap is very small there.
Yeah, 100%. One of the things I often talk, and I appreciate this is easier said than done, right? I appreciate if you're worried about your job, or you've got a high stress job, I understand that you need to work hard. But I often talk to my clients about minimum standards, and I talk about, what is your baseline, what is your minimum standard for exercise, for diet, for sleep, right? And I appreciate that this is not perfect, you can't get it right all the time, but if you have an aim of a minimum standard, minimum investment you're making in those things every day or every week,
right,
then it provides you a really solid baseline. Because then what you can do is, when you're really struggling, you can say, am I meeting my minimum standards, or what was I doing last week, and how does that compare with this week? And you can say, oh, actually, I only slept 3 hours a night this week. Okay, great. Normally I need 7 or 8. And it gives you a baseline, it gives you a comparison by which you can make sure you're investing in yourself, so that you can do all the other things that you want to do.
I love that. And I think it's really important that the minimum standards don't have to be too lofty, because I think nowadays we get so focused on social media and these kind of wellfluencers who are saying, you need 8 to 9 hours of sleep a night, an ice bath every day, an hour of meditation, exercise. It does put us in a place where we're likely to think we failed, but minimum standards can just be minimum, like you're saying. Just, I know that if I get less than 6 hours sleep at night, things are particularly rocky. If I don't go to the gym, I like to go 6 times a week, but if I don't go 3 times a week, things start to slip. So I think setting realistic minimum standards.
100%. That can You don't have to meet these minimum standards at all times. That person that goes to sleep because they've got an important thing the next day,
Mm.
if you get 5 to 6 hours sleep, you'll be okay. You might be a bit tired. I wouldn't want you getting 5 to 6 hours of sleep every night.
Yeah.
But it's that intrusive thought, it's that anxious thought that we need to move away from and just think a bit more about, what are my minimum standards? Am I meeting these minimum standards as regularly as I can? And when I don't, that's okay. That's okay.
How much, as a therapist, how much are we able to change these kind of patterns, being conscientious? How much are they kind of our personality traits, thinking, I'm the dependable one, or I'm
Mm.
always one, or who does everything? Do you think people are genuinely able to change in this regard?
Absolutely. Absolutely. I mean, again, these are traits, these are ways of working that have been built up over years and years, but often come from really good values, a really good source, wanting to be a kind person.
Mm.
But you can be a kind person without sacrificing your entire life for something else, right? Many of these values, many of these things that are important to people, you can still do, but not to an extent which completely sacrifices yourself to others.
Mm.
So they're certainly important to think about. And what we're also talking about is identity, how you want to be seen by yourself and by the outside world. People have strong identities. I'm a kind person, or I'm whatever. And again, it's matching up. This is how I want to be seen by the world, and this is how I want to be as a person. But this is also what is important to me, my values, how I want to live my life, and how do you match those things up so you are simultaneously caring for yourself, but caring for those, or living the life that you want to live to the outside world at the same time, which is, of course, a difficult thing to balance.
I mean, I think this is a good moment to come on to this idea of locus of control, which is
Mm.
something I didn't know much about, but when I found out about it or heard about it from a psychologist, I thought it was such an interesting concept, which um, it really helps people, I think, when they understand it, kind of better understand their relationship with the world. Can you give me a bit of a summary about locus of control as just a concept, and also how it applies in people's lives?
Certainly, I'll give you, I suppose, my definition of how I see it play out in the therapy room. So, a locus of control is someone's belief in their ability to influence the world around them, or influence themselves.
Yeah.
Okay. Now, where I see people really struggle is where they have an external locus of control, where everything is happening to them, where they're nothing but a passenger in life, and things happen. And of course, things can happen, but they're much more externally influenced. They see the world as influencing them.
Mm.
Where you have someone that has an internal locus of control, they believe that they have the ability to influence themselves and the world around them. And what you see is huge amounts of success for these people, because you say, what about doing this? And they say, oh yeah, I could do that. And then they do that, and then it works or it doesn't work, but at least they've done it.
Mm.
And then actually they can work through a series of solutions, or a series of opportunities or options or whatever, and they can find out the one that works, or the one that gets them to the next stage, where they can say, okay, how does the world look now? What's the next step?
And it comes down to so much more, doesn't it? Because, with locus of control, even the way you think about how you might have done in exams, how you might have done in a job interview, it's about how you view external factors, which are important. There's no doubt about it, versus internal factors, versus, like you said, your ability to change the world and change your life. So what you're saying is that people with an internal locus of control generally do better, or have a better outlook or better outcome.
I think that what I guess I want to be careful not to make out like there are people who have this or that. I don't
Yeah.
think there are two types of people in the world.
Mm.
But what we're trying to do is, when we're working with people in therapy, is we're trying to instill the idea that you can have an internal locus of control, which then is empowering, right?
Yeah.
If you think that I'm everything, I'm a leaf in the wind that just gets blown with air, then if you feel disempowered, you feel helpless and hopeless to some extent, right? Which is not what we're looking for in therapy. We want people to have hope, and when people believe that they can influence or engage with the world in a way that will improve their life, that's where you have the power to actually make a difference, and that can be incredibly successful.
Yeah, so and it's important for us to mention that this is always exists on a spectrum. So no one has a purely internal or a purely external locus of
Absolutely.
control, and we probably all move around on it from time to time.
Mm.
But if you can shift it more towards the internal, that's likely to be helpful for your psychological well-being. And I think it's important to mention as well, in health, in as a GP and in the things that I do. If I'm counselling people on whether it's obesity, weight management, cardiovascular health, looking after their heart, reducing cholesterol, whatever it is, definitely there are people with a more external focus. Like, there are things I can't change that are external factors. And I tend to see people who have a more internal locus of control, who believe I can change this. It's my responsibility to change this. Certainly, I think there is an association, at least anecdotally, with better health outcomes.
Yeah, 100%. I mean, of course, I'm not in exactly the same profession as you, but I imagine that if someone thinks I can influence my health now and in the future and does so as a result of that, logically, they're more likely to see better long-term health outcomes as a result of those things.
Yeah. Talk to me about, this comes up a lot on social media now, about rejection sensitivity. What is it, and how does it come into people pleasing and conscientiousness?
So rejection sensitivity, of course, again, is slightly different for different people, but is the idea of people are trying to avoid a sense of rejection because of the strong feelings that it might stir up in them. And it might be quite very, very difficult to cope with the idea of rejection or even perceived rejection. I think we have to remember that a lot of rejection isn't rejection. It's the feeling that one has been rejected when they maybe haven't been rejected. And what that can result in is an increase in people pleasing, or the increased desire to make sure that they are seen or perceived in a positive light, which again results in sacrificing one's own needs or feelings in order to please another person and make them like them, in order for them not to reject them.
Right. Again, one of these
Yes.
hopeless kind of cycles. One of the things that I've heard about rejection sensitivity, which I think has been so helpful, is that the reason, so often we avoid difficult conversations in our lives, whether that's at work, whether that's with an employee, whether that's with a boss, whether that's with a partner. Our natural inclination is that we think that we avoid these difficult conversations because we're worried about how we're going to make the other person feel. But actually, someone reframed that for me recently, and actually it's more about we're scared how it's going to make us feel, and that's why we don't have difficult conversations. Is that something you agree with?
I suspect the answer is probably both. Right. We are, I guess it depends on the individual, right? Some people may be more attuned to how am I going to feel as a result of this, but many may also feel about how is the other person going to feel, right? If I say to someone, I don't like my job, then, and to your boss, then they might feel really disappointed and sad for themselves. They may be, I can't believe I'm not providing an environment that's very friendly or kind or whatever for them. And they may also feel like, as a result, they may feel bad themselves because they've upset someone else. It goes both ways. It can impact the person, but they can also be impacted doubly because of the impact on the other person. Right?
Yeah.
By upsetting you and you being upset, I'm now upset because you're upset.
Well, I think that's the point I was getting at, which is often we approach these conversations with fear, and we think that fear is all about how we're going to make the other person feel, but actually a lot of it is about how we perceive we're going to feel, and also our fear of rejection for bringing these things up.
Yeah, 100%. If we have a conversation, then that conversation is going to impact the other person, and we are going to react to that automatically. Any conversation we have, right? And a person that is conscientious or wants to people please is going to try and frame every conversation in a way that positively results in a positive influence for the person sitting opposite them, so that they feel good about that conversation and about themselves as a result.
So if we're thinking about changing or improving our people-pleasing habits, one of the difficulties is that I think the natural feeling is if we push too far, we become aggressive. And there is a big difference between assertiveness, which is really important, and aggression. And so what is assertiveness? What is aggression? How do we tread the line between the two?
I think assertiveness is the method of communication which enables us to get our needs or feelings met in some way, whereas aggression is doing that potentially at the cost of another person or other people. So an assertive person may say, I need this thing because I'm tired, and an aggressive person may say, you need to do this now because I did it last time, and whatever, right? So an assertive person, they're both communicating the same thing, but one is a much more needs-led rather than blaming way, in order to not rile up the other person, but to have a sensible and healthy communication in order to get that person's needs met.
Could you give me some other examples of assertive language? I think it's really useful to
Yes.
practice this, because this is something people really, really struggle with.
Yeah, absolutely. So let's say I wanted you to, I don't know, take the bins out. Okay. I would need you to take, or I would like you to take the bins out so that I can do this.
No, I won't.
Okay. No, that's fair. So you might get that sort of response. And is it okay if we talk about this? Yeah. Okay. Could you tell me a bit more about why you don't want to take the bins out right now?
I take them out every week.
Okay. Absolutely. And I really appreciate that you take the bins out every week. But right now, I've got this presentation I need to create for tomorrow. And I would really appreciate it if you could do it on this occasion. And I know you do it every time, but I would really appreciate if you could do it so that I can get on with this presentation.
And what would be the aggressive form of that? With
Yeah.
the less obvious the aggressive form.
Yeah,
Obviously,
yeah.
we all know what abusive is, but what's the
Absolutely,
less, what's
absolutely.
the kind of less obvious aggressive form of that?
Take the bins out. I've got stuff to do. Can you just do it now? Because I've got important things to do. And can you just get on with it? It's not that hard.
Right.
Right. And you can see that I didn't let you get away with it, so to speak.
Yeah.
Right. But there was a much more, I tried to understand, I tried to appreciate that, yes, you do it all the time and work with you. But I also did stand my ground. I didn't say, okay, fine.
Yeah. It's interesting because the gap between the two is actually quite small, but the difference in communication is so different.
Yeah, absolutely. You would feel the difference. You would feel the difference in those two examples.
How does people pleasing play out in long-term relationships and in family dynamics and couple dynamics?
I would say that at the start, it might be okay in some ways, in the sense of it just seems that they're trying to please you. They're trying to make you happy. What a lovely person that's always thinking of me, always trying to make me happy. The difficulty is that then for both parties, that becomes more difficult over time. So for the people pleaser, what happens is they are, again, sacrificing their needs more and more and more and doing less and less and less. And they potentially start to resent the other person because everything they do is for the other person and they don't do anything for themselves. And then the other person can A, feel that resentment, or B, their partner loses their identity because they become this person that's just trying to please them all the time. And actually, maybe that's not what they want. Maybe, I don't know, I feel like part of a partnership is wanting the other person to be happy, to have their own things, to develop their own identity, values, loves, whatever it might be. And so both parties lose the longer it goes on for.
Okay. And so could you give us a couple of exercises? So, there are people watching who, may not be able to do therapy at the moment, or just may have some kind of lower grade habits that they want to address. So what practical tools can you do if you are watching this at home and it resonates with you and you think, actually, I am a people pleaser and it's probably a little bit of a problem for me. What practical things can you do? Can you give us some kind of take homes?
Absolutely. So if I think about the way that I work with anyone with any sort of difficulty is that people will come to me and they'll say, I want to get rid of my anxiety. I was like, absolutely, great idea. We can't just get rid of anxiety. It's a massive thing. So what we try and do is we try to specify it. And we do the same with people pleasing. So we'd look at maybe I draw it out. We'd look at people pleasing. We'd look at how does people pleasing appear in different parts of your life, with your partner, with your friends, with your family, at your work, whatever it might be. And then we'd identify what is the lowest hanging fruit here. What is the easiest way in which to make a change? So it may be that with my friends. So an example could be, we go out every week for dinner with my friends and they say they want this and I don't really want it, but I go anyway, right? And that's a really good opportunity to think about, okay, well, what can you do differently? How would you say that? Practice it. We can do role plays. Or if you're doing it by yourself, you can film yourself or just say it out loud. I think saying things out loud is very, very powerful, because it then means when you say it, it's not the first time you've said it, right?
Okay.
So for any aspect of life, always say it out loud, not when you're in front of the camera for the first time.
Okay.
So looking for examples of where you can just test it out in a fairly low risk environment to see how it feels. The second thing that you can try is, rather than it be a real and independent endeavor, is to have someone that you trust, know, can talk through with it, and have a chat about it as a subject, people pleasing as a subject, and how it might come up, and how you might want to change it. The reason why this works really well is it gives both people in the partnership or a friendship or whatever it is, because they've had that conversation, when the people pleaser then comes to an interaction and says, actually, I don't want to do that, not only are they communicating, I don't want to do it, but the person knows they've had the conversation previously. They know exactly what they're doing and why they're doing it.
Okay.
So it's not just what's going on. They're just telling me they don't want to do it and they're never like this. They're being unreasonable. They're stating their need, but they actually have the background of why they're stating their need as well, which is really, really powerful, because it gives them an understanding without it feeling like weird or different behavior to usual.
That's really, really helpful. I think you're talking about bringing these things sort of forward, effectively just not ignoring them, or at least bringing mindfulness to them in some way, whether it's pre-rehearsing your conversations, bringing it out with someone, but just, I guess, keeping it as not the elephant in the room, bringing it out in some way so that you can deal with the low-hanging fruit, at least the low-hanging fruit first. When does someone need to seek therapy, or when is people pleasing a problem, to the extent what are the signs that someone might need a bit more help from a clinical psychologist or therapist like yourself with people pleasing habits?
I suppose there's many ways in which it can impact someone's life, but a person may start to feel low, depressed, because they might live a life that is just them serving the needs of other people, which means they're not living a life that is value-led or worthwhile to them in some way, which means they start to feel low, because everything is, I do this for this person, I do this for this person, what do I do for myself, or who does for me?
Yeah.
And it results in them being a servant to the world in some way, and that can result in resentment, low mood, etc. Alternatively, you can see it in anxiety, where people, they're constantly worried about what people think about them, and so they're taking more and more action in order to please people, but getting very worried about, what you often see is the social post-mortem. So people leave a social event and they will go round and round and round in their head thinking, did they like me? What did they think of this? Did I say the right thing? And then they'll build themselves up, and what that does is it makes them next time want to try even harder to make sure they're saying the perfect things, interacting with people, etc. And with all of these things, it reinforces it and becomes a bigger thing, which makes it more difficult.
Understood. And I think from my perspective as a GP, I think where I see it as a problem is what I was saying earlier, and I'm probably, my training doesn't attune me to necessarily picking up some of the more deeper psychological aspects that you're talking about, but certainly from that conscientiousness perspective, if people are burnt out, if people are depressed, if people are severely anxious, and are really struggling in life, and it's affecting their functioning, so affecting their relationships, affecting their ability to work, affecting their education, that's definitely a time that I would say that someone has to reach out for some help.
100%. One of the ways in which we can do it as professionals is that I always worry, I bear in mind that my clients may be wanting to people please me as well, or yourself, right? You may suggest a certain medication or approach or support of some way, and they'll say, yes, Dr. Gordon, that's fine, right? I want them to challenge me. I want them to ask questions. I want them to learn. I want them to have that ownership of the process.
Absolutely.
And ask questions. And if we'll work it out together, I have expertise in training, but you're still a big party in this collaboration.
Yeah.
And I want them to be part of it. And what that does is it provides us with a really safe way in which to test and try these skills out.
Yeah.
And then you can go and use them in the world. And that could be with me or you, or it could be with a friend or a partner or whatever. But practicing these skills is a really powerful way to then apply them to the wider world.
That's a great point to finish on. Thank you so much. It's been really insightful for me, and I'm sure
My
everyone
pleasure.
watching. So thank you very much for joining. I hope to see you again soon.
I hope so.